All right. Well, thanks everyone. Thank you so much for joining today for Compassion and Choices Train the Trainer, how you can help spread the word about New York's Medical Aid in Dying Act. Um, Just a quick housekeeping note for this group. This webinar is being recorded, and we ask that everyone remains on mute. I think everyone is automatically muted, and use the chat box and the the questions. Is there a Q&A box? And the Q&A box. The chat box is for any trouble that you have with this webinar, and the Q&A box is at the bottom of your screen to submit questions. I will note that Fran and I are going to be sending out a form after this webinar. We want you to tell us how useful this was, any critiques, any comments, any suggestions, but we also want your questions. And so while we may not have time to take a lot of questions on today's webinar, what we hope to do is use the questions generated from this webinar to develop a good volunteer guide that we will be crowdsourcing from all of you in addition to what we already have to share, and then sharing it after the webinar in the coming weeks. So please, if you don't have a pen and paper handy or somewhere else to take notes as we go along so that you can submit your questions later, please do that. I also just want to say thank you to the donors that made this possible. All of the work that you see Compassion and Choices doing in the community, from the legislative campaign to the awareness work that we've been doing across the state, is all due to generous donors like many of you on this call. There will be opportunities throughout this presentation and in the future to visit our donation page and send us a donation if you appreciate this and you want this kind of work to continue. We are really grateful that we had so much interest in helping educate New Yorkers about the state's new medical aid in dying law before it takes effect on August 5th. Today's session is intended to be an introduction to this community education effort and an opportunity to walk through the Medical Aid in Dying 101 presentation that I often deliver and Fran has delivered across the state. We'll walk through that together. The goal is not for everyone to leave today feeling like an expert or ready to answer every possible question. Rather, we hope today helps familiarize you with the presentation materials, gives you a sense of the kinds of conversations you may encounter, and helps you begin thinking about the many ways you might participate in this work moving forward. We also want to acknowledge that conversations about serious illness, dying, grief, and end-of-life options can be deeply personal and emotional. People may come to these discussions with very different experiences, beliefs, and perspectives, and we encourage everyone to approach these conversations with empathy, with curiosity, and with respect. Finally, this is an evolving implementation effort. We are continuing to build out volunteer resources, support materials, and future training opportunities as implementation moves forward. And we're very glad that you're here at the beginning of that process with us today. I see that a few folks have raised their hands, but I am going to ask you to put any questions that you have about watching this presentation in the chat box, any questions you have substantively in the Q&A box. But again, be conservative with that because we're going to be asking for your questions after you hear the entire presentation. So what we're going to go over today is, the goals of our community education effort, what volunteers can expect from this work. We'll walk you through the Medical Aid in Dying 101 presentation. We'll share what the volunteer toolkit will look like in collaboration with you all and the support resources that we have for you. And then we'll talk about next steps and future training opportunities. Our goal in this community education effort is first and foremost to make New Yorkers aware that this new end-of-life option exists and understand what the law does and doesn't do. As implementation approaches, we expect that there will be a great deal of public curiosity, confusion, misinformation, and emotionally charged conversations surrounding New York's medical aid and dying law. One of the most important things we can do is to help ensure that people have access to accurate, compassionate, and understandable information before and after the law takes effect on August 5th. We also hope that these conversations encourage broader end-of-life planning discussions among individuals, families, and caregivers, and their healthcare providers. Even for people who may never pursue medical aid in dying themselves, understanding their options and communicating their values can be incredibly important. And finally, we know that trusted community voices matter. People are often more comfortable learning and asking questions in familiar community settings and from people they know and trust. That's why volunteers and community educators will play such an important role in helping New Yorkers better understand the new law and the resources available to them. As we mentioned a moment ago, this work can be incredibly meaningful, but it can also be emotional and at times challenging. Conversations about serious illness, caregiving, suffering, autonomy, grief, and dying are deeply personal, and people may approach these discussions with different experiences. You may encounter people who are curious and supportive, people who are skeptical and uncomfortable, and people who have personal stories they want to share. Part of this work is simply creating space for respectful, compassionate, and informed conversation. It's also important to remember that you're not expected to do this work alone. Compassion and Choices will continue providing support, materials, guidance, and future training opportunities as implementation moves forward and more people begin engaging with the law. And finally, we want to emphasize that there are many different ways to participate in this effort. Some people may eventually want to give presentations themselves, while others may feel more comfortable helping with outreach, event support, sharing their personal experiences, or connecting us with community groups and audiences. All of those roles are valuable and important. Before we walk through the medical aid and dying presentation that you can adapt for yourself and that we deliver ourselves, we want to spend a moment talking to you about your role as a volunteer presenter and a community educator, if that's a role that you choose to take. Your role will be to help provide general education information about the law and connect people with reliable resources, not to serve as medical, legal, or clinical experts. It is completely okay not to have every answer. And in many cases, the best response may simply be helping to direct someone to additional resources or encouraging them to speak with their healthcare team. We also encourage volunteers to approach these conversations with empathy and respect, particularly when speaking with people who may have different beliefs or concerns about medical aid and dying. The goal of these presentations is not to persuade people, but to help ensure that New Yorkers have access to accurate information about the law and choices available to them. And finally, we want to emphasize that clarity and authenticity matter far more than perfection. You don't need to sound like a lawyer or a policy expert. People connect most with presenters who are thoughtful, compassionate, and genuinely engaged in the conversation. So let's dig into this sample presentation. Fran, is there anything I need to be aware of from the chat box that what's the general sense in the room? Although I feel like I just
It's
messed
looking,
up
yeah,
slideshow.
lots of introductions. There are folks from every corner of the state here with us today, which is really, really incredible, including many organizational partners. So thank you all truly for joining us. We hope that you find this material valuable today.
That is great. Thank you, Fran. All right, so here we go. I've titled our presentation, the one that we've been delivering across the state, A New End-of-Life Option for Terminally Ill New Yorkers. And generally, when I'm doing these presentations, I put the name of the group that I'm presenting to at the bottom with the date. Recently, I've just had spring 2026 at the bottom of the slide. So I'm just going to do this as though I'm doing the presentation. All right. So today's objectives for this training are to go over with you what end-of-life options exist in New York now, even without medical aid in dying. We'll talk about what medical aid in dying is, what New York's law says, what you can do, the resources that we have available, and then take any questions. First, I'll share that Compassion and Choices is a national nonprofit organization. Our mission is to improve care, expand options, and empower everyone to chart their own end-of-life journey. We do that with a robust community outreach program, legal resources, and a Call Compassion hotline. And we will share resources about how to connect with all of those things at the end of this presentation. Let's first start talking about what end-of-life options exist currently in New York. Before getting to the options themselves, I want to talk a bit about how most people want to experience death. Because when I talk to people across the state, what I find is that most people tell me that they want to die at home, surrounded by their loved ones. They want their pain and discomfort managed. They want their spiritual needs and values respected. They want to feel safe and comforted, and they want to feel peaceful. A lot of people have this image of lying on a clean bed with a warm breeze blowing through the window and surrounded by grandchildren telling them how much they meant to them. Well, we can't help you with the grandchildren or with their reaction, but some of the resources that we'll provide may help people plan an end-of-life experience that's more in keeping with what they want. So what options are available to New Yorkers? First and foremost, all available medical treatments and interventions are available to decisionally capable adults, limited only by their ability to pay, which is no small limitation, I have to acknowledge. On the other hand, people have the right to discontinue or refuse medical treatment at any time. Any decisionally capable adult can discontinue or refuse medical treatment. That includes dialysis and other life-saving and life-preserving measures. When someone stops treatment, or when there is no further treatment available, or even while they're receiving treatment, something called palliative care is available to them. Palliative care is available to anyone at any stage of illness. You don't have to be terminally ill to access palliative care. What palliative care does is it focuses on side effects of medication, symptoms, and your quality of life. It is not meant to be curative. It is meant to help you live better during whatever you're going through medically, whether that's the end of life or any other kind of medical treatment. A subset of palliative care is called hospice. Hospice is not a place, it's a set of services that are provided by an interdisciplinary team of clinicians, social workers, spiritual care providers, and a whole host of other professionals that deliver care to terminally ill people, people within 6 months. In some cases in New York, you can have a prognosis of 1 year or left to live, but most commonly, you qualify for hospice when you have 6 months or less to live. Those services are provided to a terminally ill person and also their family. For some people, even the best palliative care and hospice is not enough to alleviate the suffering, whether that is physical suffering, existential suffering, or mental suffering at the end of life. And so some people choose to hasten the time of their death using a few methods. One of those is voluntarily stopping eating and drinking. That's sometimes known as VSED. Voluntarily stopping eating and drinking is something that can be available to decisionally capable adults, but it is recommended that people receive medical support in exercising that option. Palliative sedation is another option, less well known than VSED itself. Palliative sedation involves having a clinician basically place someone in a medical coma while nutrition and hydration are withheld. And the person dies peacefully. That's the intent. um, after a period of time. The problem with palliative sedation is sometimes that the medication has to be calibrated carefully to not be intended to bring about death. And so there are times when um, the medication isn't sufficient and the person may wake up disoriented, confused, disappointed, maybe. Or the medication provided may be too much and the person may die. As long as the provider does not intend for that to happen, that could happen with palliative sedation. When those options are not enough, or when someone wants more autonomy over the manner and the place of their death, medical aid in dying is an option that people have advocated for across the country in response to these needs. And we'll talk about medical aid in dying, obviously, in the ensuing slides. I want to make clear that none of these are either or choices. Someone can access hospice services and then request palliative sedation. Someone can be receiving palliative care, excellent palliative care, and also opt for medical aid in dying. But there's one important exception, and that is when choosing hospice care, one must forego curative treatment. That is the one exception to the either or rule here. So let's dig in and talk about medical aid in dying. Medical aid in dying is a practice in which a mentally capable adult with a prognosis of 6 months or less to live can request a prescription for medication that they can choose to self-ingest to die on their own terms. This multi-step request process, strict eligibility criteria, and other safeguards embedded in these laws ensure that anyone pursuing the option is protected. Medical aid in dying is now authorized in 13 states and 14 jurisdictions. New York was the 13th state. We had a huge year in 2025 where Delaware, Illinois, and New York all passed their bills through the legislature, and then the governor signed New York's bill in 2026. We have been monitoring how medical aid in dying laws play out in other states for a very, very long time. Many of the states that authorized medical aid in dying through their legislatures require that a report be delivered to the public health department annually. And every year when those reports come in, we analyze the data to see what it looks like. So I just want to give you a little bit of a snapshot, but we'll also be sharing with you the utilization report when we send our follow-up packet around to you so that you can see all of the data points and what implementation looks like in other states. Just over 39% of patients who had a prescription written for them did not ingest the medication. That means that over 60% of people who received a prescription chose to ingest it. What families tell us is that people who didn't use the medication felt incredible peace of mind knowing that there was an option should their suffering become too great. But people put off using the medication or chose never to use it. About 90% of those who self-ingest are enrolled in palliative or hospice care, to the point that I made earlier about the fact that these are not either or choices. And it highlights the importance of high quality care and interdisciplinary collaboration. About 80% of those who use the medication did so at home. And this really aligns with the preference of a majority of Americans who report wanting to die at home. New York's Medical Aid in Dying Act authorizes the practice of medical aid in dying. It was signed by Governor Kathy Hochul on February 6th and will take effect on August 5th. In terms of who is eligible in New York, our eligibility criteria closely mirror that of every other state that has authorized medical aid in dying in the United States. One needs to be an adult, 18 years of age or older, a state resident, and I'll put a little asterisk there for a moment. You need to be terminally ill, and that's defined in the bill as having an illness that is incurable and irreversible. You have to have been given a prognosis of 6 months or less to live. You have to be mentally capable of making informed medical decisions, and you have to have the ability to self-administer the medication. Advanced age, disability, and chronic health conditions alone are not qualifying factors for medical aid in dying eligibility. Now, I mentioned that these eligibility criteria mirror those in other states. And the one small exception to that is the state residency. There are now two states that have changed their law to allow out-of-state residents to access medical aid in dying. That's Oregon and Vermont. But every other state has a state residency requirement. I'm not going to get into too much detail here, but the process is laid out in the law. If you're giving this presentation, by the way, you might want to spend a little bit more time here, but in the interest of time, we'll just say that there needs to be an oral request, a written request, a confirmation by a second consulting physician, a mental health evaluation, which we'll talk about in a moment, and a waiting period between the writing of the prescription and the dispensing of the medication. And the waiting period can be waived if the physician believes the patient will die during that waiting period. Some additional provisions are that the first evaluation needs to be in person with a waiver available for people who would experience hardship if they were required to travel for that appointment. There are strict conflict of interest rules for witnesses and interpreters, criminal penalties for coercion or abuse. Violations by providers of the law are subject to both criminal penalties and professional discipline. Religiously affiliated home hospice providers may opt out, but that cannot limit the ability of someone receiving care at home to utilize the law with other providers. Just like in other states, the State Department of Health will be required to issue a report and provide oversight to this program. And as I mentioned, there will be a 6-month period of implementation, which we are, I think, about 3/4 of the way through right now, maybe 2/3. Bad at math. Just a note about the mental health evaluation. This will be a determination by a psychiatrist, a psychologist, or a neurologist that the requesting patient is mentally capable, which means that they have the ability to understand, to weigh their options, the benefits and the risks, to make an informed decision, and to communicate their choice to their provider. I'm going to preempt one question that I know everyone asks, and that is, what if someone can't speak anymore? And the interpretation provisions in the law and ADA rules that govern healthcare generally cover that and allow for people to communicate their choices to their healthcare providers in the way that is available to them. There is no standard or required prescription set forth in the legislation, nor should there be. Medicine is an evolving practice. The pharmaceutical industry changes, and the practice of medicine is called practice for a reason. People learn, they grow, and different routes of administration become available. When providers are thinking about what medications to prescribe, they need to consider what route of administration will be effective for the person. There's generally a mixture of medications that relieve nausea and slow breathing and stop the heart. These medications are prepared at the moment currently only by compounding pharmacies, and they are dispensed as a powder mixed with fluid at the time of self-administration. If you're wondering if your community has a compounding pharmacy, they may not be available, and some of those pharmacies may not participate throughout the state, but rest assured, New Jersey has one compounding pharmacy, and availability of the medication through that pharmacy has not proved to be a barrier from what we understand in New Jersey. These medications can be mailed, in other words. So don't panic if your community is without a compounding pharmacy. As I've mentioned, participation in the medical aid in dying law is entirely voluntary for providers, for patients, for everyone. And there are legal protections for everyone who follows the requirements of the law. No one is denied access to what their health insurance plan currently covers because of the availability of medical aid in dying, and families are not deprived of life insurance payments if someone chooses this option. That is written into the law, and it has been the case in every state that has passed a medical aid and dying law. The law provides privacy and dignity for both patients and families. So now that we've talked about what the law does and doesn't do, let's talk about what you can do. Um, you can sign up for Compassion and Choices mailing list to stay abreast of what's happening. We're in a critical period right now where we're waiting for the New York State Department of Health to issue draft regulations that will be released for public comment. If you sign up for our mailing list, you will be among the first to learn when those regulations are released. We encourage you to empower yourself with Compassion and Choices Finish Strong tools. We also encourage you to ask your own doctor and talk to your own healthcare team about their willingness uh, to abide by your wishes and to deliver care that's consistent with your wishes and values. A lot of healthcare institutions have patients groups. And if you yourself are a patient and you want a say in how your healthcare institution is developing its policies, I would encourage you to seek out a patients group. What we have learned is that some healthcare institutions only want to hear from patients as they're developing these policies and procedures, not from outside groups. And so if you're someone who wants to get more involved in that way, seek that out. You can help us identify other public education opportunities, and you can become a volunteer and learn how you can share information about this new right in your own community. Compassion and Choices has a whole suite of Finish Strong resources for you and your community. We have an end of life decisions guide and toolkit that's available both online and you can send away to have it mailed to you. We have a policy book that sets forth all of the research and the evidence around medical aid and dying. We use this quite a bit during the legislative campaign. As I mentioned, we collect all of the data from state health departments across the country and publish a utilization report every year. We provide guidance for clinicians, and we have a 1-800 call compassion line that terminally ill people and their families can contact to get help in navigating their end of life choices. We also put up resources on our Compassion and Choices New York landing page, and we have just finished a patient access booklet, which goes into a lot more detail about what patients and their families need to know about accessing this law. That booklet will be updated once the State Department of Health regulations are released, and we know more specifically about what some of those requirements will look like. So this is the part of the presentation where we would normally ask for questions from the audience, either in a virtual setting or in person. And then we would end by saying what I said at the beginning, which is that Compassion and Choices is funded almost exclusively by individuals, donors like yourself. And with sufficient resources, we can realize end-of-life choices in every state. Every donation of any amount makes a difference, and we would encourage people to consider making a donation today. And with that, we generally put up our contact information, sometimes a phone number, sometimes an email. This is for Fran and I, but if you're doing a presentation yourself, you might want to add your own contact information or not. You can include ours. And with that, I say thank you for listening to this part of the presentation. And I think I'm going to turn it over to Fran now. Is that right, Fran?
Think so. Will you? Yeah, perfect. Beautiful. So,
Let's stop though and say, is there anything that we need to know about the chat box or the Q&A, or is it going along swimmingly?
looks to me like it is going along swimmingly. It looks like there are two questions in the Q&A, and it looks like Katie is already on it. Thank you, Katie. I really appreciate that. Um, so in that case, though, nothing else in the chat.
Great.
Um,
Thanks.
Yeah, of course. So we really wanted you guys today on this call to listen to Corinne deliver what we would ordinarily deliver in the community. I know for myself, I learn really well when I can hear how someone else might deliver material. And with something as important and nuanced as this topic in general, and specifically the New York law, we wanted to make sure that before you went off into the world to present this material to your local communities, that you heard how other folks might deliver it. So that is the portion of the presentation that Corinne has just wrapped up. And now I'll talk a little bit about some of the resources that we are in the process of developing to help you as a volunteer presenter bring this material into your communities. Um, we know that we are cramming a lot of information into an hour. It's a lot to absorb in one single session. And for the record, this will not be the only session. We intend to, as this process and this volunteer presenter program expands, we intend to hold additional, maybe more specialized education webinars like this one. Um, but we don't expect that you'll leave today feeling like an expert, and that's okay. This is really just the beginning of the process and the journey for community education. And your feedback as volunteer presenter will be a really important part of this ongoing process. And we really welcome, as Corinne mentioned at the top of the hour, your reflections on the material in the presentation itself, your questions, your ideas, what might help you feel more prepared and supported as community educators. And we hope that we hope to use that feedback to help shape these toolkits and these resources that we're creating. Um, because this is such a new law in New York, we expect all of us, including Compassion Choices, to continue learning as our implementation moves forward, as the Department of Health releases the regulations. And as such, you'll be getting a lot of follow-up material from us after today. We'll send out, like Corinne mentioned, a follow-up form to share your feedback and ask questions, and to let us know what kind of resources are most valuable to you. Uh, Otherwise, though, what you can kind of expect from us is a comprehensive toolkit, more or less, to support you in delivering this material in the community. So we will put together something in the coming weeks. We will finish putting together, it's well under development, something that will include the slides that Corinne just shared with you all, with suggested speaker notes too, FAQs, suggested responses for those FAQs, links to and information about how to find or share the resources Corinne shared as part of that presentation, other outreach and event materials that you can bring with you to in-person events. And we will also be sure to keep everybody abreast of follow-up trainings, which is another reason it's very important to sign up for our mailing list, because that's the only way we can reach you with regular updates about, when the Department of Health, excuse me, releases the regulations, but also when we have developed or scheduled additional training opportunities. Um, and also it'll include the recording of today's session. Next slide, please. Thank you. So we will continue sharing updates as we've mentioned, practicing opportunities, messaging guidance, additional support. Some of you may choose to present this material independently on your own. We love that. We fully hope that you feel empowered to do so. You also should know that we are available to support you or co-present, or, really make this a collaborative effort if that's how you'd like to make this happen, in your own communities. Um, some of you may simply handle the sourcing of opportunities in your communities and feel like passing them on to us, and we handle the rest. Whatever the partnership between us and volunteer presenters look like, we are here to collaborate. We just want to be able to get this information to every corner of the state. So, as such, we hope that you will, when we send it out to you, review the volunteer toolkit materials, Reach out to us if you have questions about the materials. Rehearse the presentation yourself because the toolkit will include ways to access that slide deck so you can view it, rehearse it, time yourself, get comfortable with the material with the suggested speaker notes, and then start thinking and looking within your own networks about where you might be able to find potential speaking opportunities. It could look like your local library. It could look like a club that you belong to. It could look like an institution you belong to. Maybe your department has an in-service training. Um, that could be an opportunity. Stay connected with us, certainly, for implementation updates. Participate with us, hop on these calls again to practice again in the future and receive more training. And really just truly for any questions you have about logistics, please reach out to Corinne or myself for support. We have materials, we have scripts you can use to get you started and off the ground if that makes you comfortable. If, we have handouts. So we are here and we are available. Next slide, please. So as we begin wrapping up, we want to emphasize, hopefully it's become clear that there are many different ways to participate in this community education effort, and the toolkit that you will receive from us will give you more examples for ways to engage in this community education. And we hope that really that we've made it clear that the community education is not work that we can do alone here at Compassion and Choices, just a team of Corinne and myself. And that it's really important in many communities that folks hear from the people that they know and that they trust, which is where you come in. So we'll follow up today with an email that will include resources, including that feedback form that we keep mentioning for your reflections and your questions. We also ask that you help us identify opportunities for speaking. Either we partner with you to host these opportunities, or you source them and execute them yourselves, assist with the outreach, the logistics, recruitment of the folks to attend these discussions, facilitate question and answer sessions. These things can really look like a lot of different formats. They can look like a Google slide presentation like the one Corinne shared with you. They could look like a panel discussion. What's important for you to walk away today knowing is that whatever the opportunity looks like in your community, we have resources available to support you in making sure that you have all the facts that you need and that you feel empowered to share them. So I think this may be the end of our discussion today. Corinne, do you have closing notes for folks? Oh, you know what? Before we go, I'm so sorry to cut you off. But before you go, I did want to share my screen if that's all right, because we have a little bit of time. We keep talking about this toolkit and it's not finalized yet. However, I would like to just briefly show you what it looks like under development, um, so that you have an idea of what we're walking into and what we're talking about. So if we could swap whose screen is being shared, or perhaps Corinne, maybe you can pull the toolkit up. Either way. Okay, I'm gonna give it a try. Bear with me here.
Sorry, yes, I was muted. It's
Oh,
like
sorry.
it's like I'm in 2019 all over again.
I was probably talking over you that whole time. Sorry about that. But all right, let me share my screen so you can see what's under development. It's very much draft form in this moment. But we just want you to know that the scope of what we're going to be providing you. Um, so, of course, we have an introduction here that will explain to you everything that you will find inside the toolkit, a lot of guidance, scripting, best practices for securing speaking opportunities. Um, which we start off with right here, finding and sourcing these opportunities, what to include in your ask of these organizations, because sometimes it might be a cold call, right? You might be cold calling into a senior living facility if you're not reaching out to somebody who's already within your warm network. And so we like to give you guidance about what kinds of things to include in your ask. We also will provide you with the actual presentation, a link to it that Corinne shared with you today, as well as some practical and technical tips. I also have developed a guide, a glossary, if you will, of the various handouts and pieces of event materials that we generally bring with us when we host these events in person. And I've also included for each event, each material, excuse me, ways to access the online version for when you're holding virtual events. So, really, we just want to make sure that you have everything in your hands that you could need, regardless of the format or the exact goal of the presentation that you'll be giving. We've also included some frequently asked questions and our suggested responses to them. And then finally, we will be giving you troubleshooting information here at the end, as well as my contact information and Corinne's. So, again, forgive me for kind of the bare bones nature of how that toolkit looks right now, but we're working on finalizing it. Now that you've seen it, now that you've heard the presentation, we ask you to go away today and just kind of think about what you would need from us if you were standing in the community center, in the room in your local library, and you had an audience in front of you and you wanted them to know everything they could need to know about New York's Medical Aid and Dying Act. And then share that information with us on the feedback form, and we will tailor the toolkit accordingly.
Fran, I think since we did an incredible job on time, not to self-promote or anything, but we thought it would take a lot longer. Since we have 15 minutes left, I do want to open it up to some burning questions. I would prefer that they be process questions. I'm reading through the chat, and I'm sure I'll have a chance to look at the Q&A as well. And a lot of the questions that you're all asking are questions that will be in the FAQ. So I just want to assure you of that. But let's see if anybody wants to make any comments or say anything. And it looks like Betsy. Does Betsy want to be unmuted? Katie, I'm not sure if Betsy can be unmuted, but maybe we could.
Okay, I think I'm unmuted now. Can you hear me?
Yes, we
Great.
can.
So, first, I want to say thank you. This is incredible. One thing that it's not clear if it's in the toolkit that I think would be terrific is if you had something that we could easily copy as a handout. And I'm not clear that that was something you were thinking of. But I think that this is going to spark a lot of anxiety. People won't remember everything,
Mhm.
and to go away with something would be fabulous. Maybe not all of it, but the highlights, so then they know where they want to come back and ask more questions. So thank you.
Yeah,
Yeah.
we definitely have a one-page fact sheet on the law. So that I think you're gonna find very helpful. And we have
Okay,
longer ones too, but the one
yeah.
pager is very
Okay,
handy.
great.
Yeah.
Thank you.
We've got, oh, Nancy Murphy has raised her hand and someone else too. Could we pass it over to Nancy?
Can you hear me? Yes?
Yes.
Good. Okay. I'm very disturbed by the requirement that there be a consultation with a psychiatrist or psychologist. And I looked up what a psychologist is online, and one definition was they had to have a PhD, and another definition said they had to have a master's degree. Do you have any idea what direction that's going?
I think we're going to have to wait to find out what the regulations say. But the law itself says a licensed um, provider. So, but Nancy, I share your concern. I hope it's as broad as possible, and I think we will see in the draft regs. And then when the regs come out, If we don't like them, we have an opportunity to make public comment. And believe you me, is what I meant to say. We will be, if that's the case, then we'll be mobilizing people around that issue.
Good, thank you.
Oh, great. Fran just posted the outreach flyer and although it says fire, outreach flyer, it's fire. The outreach flyer in the chat box. Um, Virginia has her hand up. Virginia Testy.
I'm sorry, can you hear me?
Now I can, yes.
Okay, thank you. I'm just wondering, Chenango County is predominantly a very conservative county from what I've seen. And do you know what the climate or the reaction is to this method and way of thought in this county?
Nope. Though that's the kind of thing that we need you for. We need to collect information from people around the state to tell us what the reaction has been. So
Okay,
yeah, I mean, if you
understand
find
that.
out anything, it would be helpful for us to know.
I certainly will. I will certainly try because this is something I've been interested in for a long time. Um, and dying is a very personal thing. And I think it should be up to anybody.
The vast
So
majority
there
of New Yorkers agree with you, Virginia. I'm
yeah,
glad.
I don't know about this county, but you know,
Yeah,
there's a lot of suppression through family and you know your social contacts where people feel like they're alone and they don't know there are other methods, other ways to decide how you want to die.
that's right.
So I will certainly look into it.
Well,
Thank
thank
you.
you and share whatever you learn with us. One of the questions that I've seen in the chat box, which everyone asks me, is whether we're going to be developing a list of providers, either doctors or psychiatrists. And I will tell you that Compassion and Choices does not maintain a list, and that's deliberate for a few reasons. One is because we hope that that list is ever evolving and that more and more providers join all the time, and this is not something static. We think that people should be asking their own providers and not seeking outside providers for this to grow the list of clinicians who are willing to participate. I will say, though, that there are other organizations that we work with that are considering doing this. So you will not see that list from Compassion and Choices, but you may from another organization. So thank you for asking the question.
There's another
Uh,
question in the chat, Corinne. Someone asked, I'm just grabbing it because it's right in front of my eyes, about dementia
yeah.
and eligibility for medical aid in dying.
Yes, that is a question that you will get at every presentation that you give. And so I will just tell you that this is the answer. Medical aid in dying is not for people with dementia or Alzheimer's. Medical aid in dying solves a particular end of life problem. It does not solve every end of life problem. We need to do a ton more work to improve access to and the quality of hospice. We need to do more work in promoting palliative care. And we need to do a ton more work on helping people navigate dementia and Alzheimer's. Medical aid in dying is for people who are decisionally capable, and there is no state in the United States that allows someone to designate their wishes for medical aid in dying. I mean, you can designate those wishes, but you cannot actualize those wishes after you've lost capacity. So you cannot give a guardian or a health proxy or a family member or a healthcare provider advance wishes to use medical aid in dying when you've lost capacity. They cannot do that in any state in this country. Um, so we have a whole suite of tools on how to plan for the care that you want should you be anticipating or trying to plan for a dementia or Alzheimer's diagnosis. It's an incredible toolkit that I went through with my own mother. And I have to tell you, I learned more about my mom and her values through using that tool than just about anything I've ever done. So I strongly encourage you to check out the Dementia Values and Priorities tool that's available on our website. Is there anyone? Oh, Amy DeBoe. Also, I'm not sure if I'm saying your name correctly, but Amy has her hand up. Can we take a few more questions?
Yeah, if someone is a snowbird and the other state is their primary residence, but they are half the year in New York, can they access medical aid and dying in New York, or they have to change their residence back to New York?
I think I missed the first part of your question. Can you say it again? You were a little muffled.
Oh, sorry. If somebody is a snowbird, say they're down in Florida half the year and um, that's their primary residence, can they
Yep.
access it when they're in New York? Or do they
So
have
that's a very good question. And I believe that we're going to be getting more guidance from the Department of Health when they promulgate regulations. There has been a question, and you'll get it up until the law is in effect, what constitutes a resident of New York? And we don't know yet. That's being left to the Department of Health in their regulations. What I suspect will happen is that they will use the same determination for Medicaid eligibility for medical aid in dying. So different proofs of residency, which could include an affidavit from someone who's a New York resident, mail in your name, utility bill, voter registration. This is not an exhaustive list today because we don't know. I'm telling you that I think that that is likely going to be the direction. So I would imagine that a snowbird would easily be able to prove residency in New York under those standards. But again, we have to wait and see what the health department regulations are. And if they are more restrictive than we like, we've got our voices.
Yeah, thank you.
I
Uh,
would just like to call out from the chat also, there are a great number of you who've chatted in, uh, expressing already that you've been inspired and you'd like to start presenting in the community to various groups in your network. That's wonderful. Um, so certainly, you don't necessarily need to, wait for our go ahead to begin sourcing those opportunities, but I would appreciate it if folks shot me an email after the fact, just so that I don't lose you from today's webinar. Shoot me an email, and I can get you materials, even though our formalized toolkit is not yet finalized. I can give you materials galore to support those speaking opportunities. So I'm going to put my email address in the chat again here. Um, and if you're one of those folks who already has the wheels turning and has opportunities in mind, please let us know. And we're here already and available, regardless of the status of the toolkit draft that I've shown you today.
We have time maybe for two more questions from the hands raised. Margaret is next, but Katie, I just want to say somebody wanted to know how to copy the chat. And I also want to address a question that I think I saw a couple of times in the chat about people who are developmentally disabled. This was something that was a huge conversation with various state agencies at the beginning of the campaign to pass this law 9, 10 years ago. There are no categorical exclusions in this bill. So if you have a mental health issue, if you have a developmental disability, no one is automatically disqualified from using medical aid in dying, but someone has to be decisionally capable and able to make their own medical decisions. That is not a capacity determination. Those two terms are very important, the distinction. Capacity is something that a court decides, and you could be determined to not have the capacity to make medical decisions. And that could overlap with not being decisionally capable of making the decision around medical aid and dying, or it may not overlap. So when someone says, what about the developmentally disabled? Everyone has the right to seek medical aid in dying and request it. Whether one qualifies is another question. So I just wanted to make that clear here because I saw that question come through a few times. Can we have Margaret unmuted? Yep, Katie, that's a very good point that the chat can't be copied, but we are recording the important questions and comments, and we'll be following up with people by email. Do we have Margaret unmuted?
Yes, Margaret, you have access to speak.
Hi, Margaret. I'm not sure if Margaret still wants to speak. Is there someone else who has their hand up, or are we good? I think we're good.
I think I want to give just a moment because I think Margaret has been able to come off mute twice and I think we've lost her.
Spoke over
So I
her.
just want to make sure she has an opportunity.
Margaret, it's hard for me to be quiet, but I'll try to be quiet for a minute.
No, it's not you. I think it's weird Zoom tech.
I was
There
looking
you
to get the chat, a copy of the chat, which you just said can't be copied, correct?
That's right.
And a copy of the slides.
That will definitely be in the follow-up email, the copy of
Okay.
these slides. Yep.
Okay. Thank you. That was it.
All right. Well, I think we did a really good job respecting everyone's time. So I think we are going to wrap up. And thank you for attending this orientation session. There's much more to come, a lot of opportunities to get more involved. Please sign up for our mailing list. If you're here, you're probably on it, but that is the first place that you will find out about the regulations being promulgated. So that's the next step here. And I look forward to chatting with you all individually in your various regions or back here on Zoom sometime in the future. And I hope you have a great rest of the day.